The effects of the budget are now beginning to trickle down, and people are realising just how much they are going to be impacted by Rachel Reeves' plans and how badly some of these plans have been thought out. So the significant concerns have been raised by healthcare providers outside the core NHS. And whilst NHS bodies and other public sector organisations are technically exempt from the national insurance employer increase, private care homes, hospices, and quite a lot of GP practices, the surgeries which are run as private firms, are left to shoulder this additional tax burden, a move that risks destabilising sectors already struggling to balance their finances. Dr. David Wrigley of the British Medical Association describes the rise as monumental, warning that many GP practices already operating appallingly under severe financial constraints will be pushed to breaking point. And while the Department of Health and Social Care has promised further clarification, the Treasury Minister Darren Jones confirmed GPs would bear the burden as private entities despite protections for smaller practices. The impact, however, is anticipated to be uneven and could exacerbate disparities within the healthcare sector. So if you're having problems with your GP, that is only going to get worse. So GPs presumably will become even harder to get hold of because fewer will be employed. Social care, employing over 1.7 million people, faces perhaps the harshest impact. According to Mike Padgham, head of the Independent Care Group, the additional national insurance costs will likely to be passed on to service users, particularly challenging a sector already underfunded by local authorities. Hospice UK echoed these concerns, highlighting how the rise jeopardises fair pay for their staff and calls into question the government's commitment to fair treatment for NHS adjacent service providers. In response, Health Secretary Wes Streeting has acknowledged these concerns and suggested potential support for social care. However, the promised $600 million infusion into social care may barely offset the impact of rising staffing costs, with sector leaders cautioning it will likely be wiped off instantly by the new national insurance rate. Surely the point is, it just takes a moment for Rachel Reeves to say that here is another exception. While defending her national insurance increase as a necessary step to fund public services, she faces criticism over its targeted impact on some of the most essential yet financially fragile healthcare services. With the rate jumping from 13.8 to 15% and set to raise a significant portion of the projected $40 billion tax in revenue, healthcare providers outside the NHS are left to question whether they've been overlooked in the government's bid to bolster public finances. As further policy details emerge, stakeholders across healthcare will closely watch for any relief measures or clarifications in the weeks to come.